Welcome everyone to this video about non-specific interstitial pneumonia or NSIP. In this video, we'll explore what NSIP is, what causes it, how it affects the lungs, and what can be done about it. We aim to provide a comprehensive overview of this lung disease for both patients and those seeking to learn more. The exact cause of NSIP remains elusive in many cases, making it idiopathic. However, several factors have been associated with its development. These include autoimmune diseases like rheumatoid arthritis, systemic lupus erythematosus, and scleroderma. Certain environmental exposures, such as exposure to molds or dust, and some medications have also been implicated. Identifying the underlying cause, when possible, is crucial for effective management. NSIP primarily affects the interstitium, the tissue surrounding the air sacs, or alveoli of the lungs. In NSIP, this interstitium becomes inflamed and thickened due to the infiltration of inflammatory cells, primarily lymphocytes and macrophages. Over time, this inflammation can lead to fibrosis, or scarring of the lung tissue. This fibrosis makes the lungs stiff and less able to expand properly, impairing their ability to effectively transfer oxygen into the bloodstream. The reduced oxygen transfer leads to shortness of breath and other respiratory problems. NSIP is a relatively rare lung disease, but its exact prevalence and incidence are difficult to determine because it can be mistaken for other interstitial lung diseases. It's estimated to account for around 15–20% of all idiopathic interstitial pneumonias. NSIP tends to affect adults between the ages of 40 and 60, with a slightly higher prevalence in women compared to men. The signs and symptoms of NSIP can vary from person to person, but they often develop gradually over months or even years. The most common symptom is shortness of breath, especially during exertion. Other symptoms may include a dry cough, fatigue, and chest discomfort. Some individuals may also experience weight loss or muscle aches. It's important to remember that these symptoms can be associated with many other conditions, making accurate diagnosis critical. Diagnosing NSIP requires a combination of clinical evaluation, imaging studies, and sometimes a lung biopsy. A physical examination will assess your overall health and breathing. High-resolution computed tomography, or HRCT, of the chest is a crucial imaging tool that can reveal characteristic patterns in the lungs, such as ground glass opacities and reticular abnormalities. Pulmonary function tests are used to measure lung capacity and airflow. In some cases, a lung biopsy, either through bronchoscopy or surgical lung biopsy, may be necessary to obtain a tissue sample for microscopic examination and confirm the diagnosis. NSIP is broadly classified into two main histological subtypes, cellular and fibrotic. Cellular NSIP is characterized by a predominance of inflammatory cells in the lung tissue, while fibrotic NSIP shows more extensive scarring. The cellular subtype generally has a better prognosis than the fibrotic subtype. The subtype is determined by the pathologist based on microscopic examination of the lung tissue. Treatment for NSIP focuses on managing symptoms and slowing the progression of the disease. Corticosteroids, such as prednisone, are often the first-line treatment to reduce inflammation. Immunosuppressant medications, like azathioprine or mycophenolate mofetil, may be added to further suppress the immune system. Pulmonary rehabilitation programs can help improve lung function and quality of life. Oxygen therapy may be necessary to maintain adequate blood oxygen levels. In severe cases, lung transplantation may be considered. Because the exact cause of NSIP is often unknown, primary prevention is challenging. However, avoiding known environmental exposures and prompt treatment of underlying autoimmune diseases may help reduce the risk. Regular monitoring of lung health is advisable for individuals with risk factors. The prognosis of NSIP varies depending on several factors, including the subtype, severity of the disease, and response to treatment. Generally, individuals with the cellular subtype have a better prognosis than those with the fibrotic subtype. Recent research is focused on identifying biomarkers that can predict disease progression and treatment response. Clinical trials are ongoing to evaluate new therapies for NSIP, including antifibrotic medications. Early diagnosis and prompt treatment are essential for improving outcomes and quality of life for individuals with NSIP.